Good evening and welcome to Live United. Live United is an opportunity for us to share stories and programs across the Monadnock region that are making a difference in people's lives. Tonight I'm joined by Amelie Gooding. Amelie is involved with Phoenix House here in Keene. Welcome, Amelie.
Thank you.
And thank you for being with us. I'm excited to have you here, Amelie, because, I've always been very heartfelt about substance abuse and the impact on people's lives here in the Monadnock region. And you're really doing some incredible work to help people with that issue. And I know you also do a lot of work in terms of advocacy across the region. And we'll get to all of that in a minute. But tell us a little bit about Phoenix House.
Phoenix House has been around for almost 2 centuries, though its affiliation in the Monadnock region happened when Marathon House became Phoenix House, and that was in the late 90s. So I started with that program, Marathon House, back then, and then Phoenix House bought the Marathon House. So there's a facility in Dublin, which I think most people are more familiar with than the one in Keene, which is where I've been for 18 years. And the Phoenix House is a national drug and alcohol prevention and treatment foundation center, and they treat families, children, adults with substance use disorders, which is really talking about addiction to alcohol and other drugs.
And I like that you said addiction to alcohol and other drugs, because I think lots of times people in the public may not see that they are truly all drug abuse.
Right.
And that includes whether it's alcohol or marijuana or anything else. And we know that in society right now, we're certainly challenged with what we're seeing happening in relation to substance use and substance abuse disorders. You mentioned that it's sort of had this evolution, and you mentioned you have a Dublin facility and the Keene facility. Can you tell us what's different about the 2 facilities that are here in the Monadnock region?
Sure. The Dublin facility is actually a facility we own, and it has both our adolescent residential program and an adult program that is funded by public dollars primarily, though they can take private insurance. And with the whole, Obamacare and new health exchange, it'll probably be more of that sort of Medicaid client that will be able to go to treatment there. In the Keene facility, we've had various sort of evolutions, but we do the continuum of care from outpatient, intensive outpatient programming to residential to what's now called boarding, which is really an evolution of the payers, which is the insurance companies. And they want to pay for the treatment, but they don't necessarily want to pay for the room and board. So we have now come up with this. Some people will get residential treatment, but most people will be boarding at the Phoenix House in Keene and then going to group and sessions all day and then various programs.
Wow, so there's quite a distinction between the 2 programs. I'd like to focus in on the Keene program because I know that's what you're really involved with. And I believe we also have some pictures that we'll bring up in a minute of the Keene program. But has that always been part of this evolutionary process with Marathon into Phoenix House, the Keene location, or was that something that came in to really meet a need?
Well, the Keene location actually started when the Dublin facility was trying to provide detoxification, and at that time there was a lot more alcohol than there was heroin or opiates. And so they would sort of go around Keene and see people that needed to be detoxed and take them to the Dublin facility. And it was sort of too far from Keene and the hospital and the police and all those things. So they opened the Keene facility really as a detox program, and that, when I came there, that was really what we were doing. We were doing detox residential treatment because 18 years ago, people stayed in residential treatment. The trend has been, as we have developed more medications to do medication-assisted recoveries, and as we've developed sort of this idea that it's not a acute single episode, but it's like an ongoing process, and that people go in and out of their recovery and their addiction, you know, the payers got sort of tired of paying for these continual 30-day or longer programs, and they said, you know, let's just. So there's the medical model that's sort of a difficult fit in some ways to the process of recovery. But I wanted to say something, Kelly, about when you mentioned the alcohol versus the opiates and how you were glad I said alcohol and other drugs, because, you know, I would say in Keene, where we have 18 beds or room and board slots, you know, 65 to 75% are opiate addicts, and the rest are alcohol. And you know, there used to be this thing, well, you're an addict to opiates, you know, I'm just an alcoholic, and that sort of sense that, you know, it's more accepted in society or it's more understood. But in fact, you know, the treatment for addiction is not very different. As you said, exactly, an addict is an addict, and you've got to really look at those behaviors and at the, you know, maybe the disease in the brain is not exactly the same for alcohol as opiates, but in the end, it's the same treatment and it's the same kind of person. So there's a lot of, you know, people that go to Alcoholics Anonymous, which is a self-help group, which is a big part of treatment now, much more in a way than it was when I started, where even the insurance payers are saying, you know, are your clients going to self-help groups? Because that's a system out there that's throughout the world. It's cost-free, it's anonymous, there's no judgment. And so there's Narcotics Anonymous and there's Alcoholics Anonymous. And different people sort of prefer one group to the other. There's slight differences between them. So we feel one of our jobs at the Phoenix House, while they're there for those 3 to 4 weeks, is to expose them to what those meetings are. We have a few of them in-house, and then we have them go out to meetings, which is why to be located right in Keene is a great asset to our program. I mean, our clients go to meetings all over our community, and we're sort of well known for being a very welcoming, recovery-oriented community. So we might have a lot of drug problems and alcohol problems, but we also have a very vibrant, alive recovery community.
So let's talk about that in a minute, but I want to pull up the pictures
Okay.
of your facility so that people can see that this is a typical house here in Keene.
Right.
But you have some great programming going on inside there. And we are seeing right now your actual facility here in Keene.
Right.
And where is that located?
It's at 106 Roxbury Street, which is right across from the Valley Forge building and down from the old YMCA facility. So it's, you know, literally 2 blocks from Central Square.
And I think in the next one, we're seeing an actual room in
Right.
that facility.
Right. So, you know, we have 10 single rooms and 8 shared rooms. So this is an example of a single room in the facility. We also have an apartment behind the house that we've added because, again, boarders technically don't have to be under residential, you know, 24/7. So certain people that are in the residential level of care will always be in facility, and as people progress or don't need as much supervision or assistance, we can move them out to the apartment.
And I know in this next one that we're actually seeing people working in a group.
Right. So the greatest modality, and this is sort of a foundation of treatment for addiction, is that the group process is really very powerful, in some ways more than one-on-one. I mean, if you have a group of addicts in recovery and not just the professional, but everyone else sort of, you know, giving you feedback, and it just is, it's a huge boost. And it's what's then duplicated in the AA and NA communities, where it's groups of people working together. And, you know, asking for help is a huge component, and being able to confront things in an appropriate way rather than stuffing your feelings or numbing your feelings, you know, all those things that addicts are good at doing.
And, you know, you mentioned the word disease, and I think it's so important for us to highlight right now, because I think for years we've seen it more as, people make that choice.
Right, it's a moral,
it's a moral
deficit
issue.
or failing or something's, and yes, it's definitely as well a disease, and it's comparable to diseases such as diabetes and asthma and heart disease, where not everybody that picks up a drink of alcohol or takes a painkiller is going to become an addict. I mean, actually, very few people do. But the ones that have the disease of addiction, which tends to be genetically predisposing, I mean, not every person who has it in their family, but again, your odds are greater, will not have control over that piece of it. What they do have control over are the behaviors that they learn or choose to do differently to stop the cycle.
And you mentioned the support system that's out there. You have Phoenix House, you have Alcoholics Anonymous, you've got Narcotics Anonymous. You even have support systems for families, things like Al-Anon, so that they can
Yes.
also build those skills that are necessary to really support that disease process and addressing that disease. One of the things we've seen happen is I think we've got this shift away from the moral beginning to happen. I think that's a healthy shift on the part of the public and society to really recognize this as a disease, and that recovery is a lifelong process
Right.
for those that are in recovery.
Right.
And that they may relapse. But
Right.
that part of it is giving them the tools to really know where to go to address that disease
Right.
when it reemerges. It's just like you mentioned diabetes or, asthma.
Right.
You have to learn
Right, you have to
skills.
change your diet, and then you have to resist those things that you once wanted to eat all the time, and sometimes, you fall off the wagon, but if you can learn from the relapse, then I don't see it as this horrible thing. And that's why I think in part we're looking at those as a learning experience. Like, what was it in my recovery plan that didn't work? We've had people that, we have an intensive outpatient program, which is also groups, but it's for people who have enough support in their community, whether it's their family, their jobs, that they're not needing to board, or they live close enough by that they can, come to the facility in Keene. But we've had people that would get a job or see that they'd just be walking by a convenience store, and one day they just walk in and, without thinking, buy a beer and drink it. And, obviously that's not what they're supposed to do. And so, I'm not going to discharge them and say, you're bad and you relapsed. We're going to say, what were you thinking? And maybe it's as easy as taking a different way to get to the facility. I'm not going to say you're always going to be able to avoid every single trigger, but that's really what we try to do, is teach them what are the things that trigger you, whether it's emotional, physical, all of the different things, and then how do you respond to it?
So talk to me a little bit about how you think it makes a difference in the lives of people right here in the Monadnock region.
Well, we have probably 300 admissions a year, and more than half of those are right from the Monadnock region. So, that's a small number of people. There's all the people in Dublin, and, so there's a great number of people right there, and probably that's 1 in 12 people that are addicted to drugs or alcohol who are actually coming to treatment. There are so many reasons why people don't seek out treatment. Whether it's that they don't know there's help, or they don't think they can arrange for childcare, or what's their loved one going to say if they knew. There are a lot of barriers. So the more we can say it is a disease and there's nothing wrong with you as a human being and we're here to help, and that it's a process, as you said, where you can go for maybe the intensive outpatient, if you live in the community, lasts a total of 12 weeks. And then we have an ongoing recovery support group that's once a week for an hour. And I have 10 people that come back that have completed our program, that are clean and sober. 4 of those are on assistance from medication. They're on a medication called buprenorphine, which has had mixed press, I think, but it's helping them to go to work and live normal lives, and they're working on their issues, but they're not relapsing and losing everything and then having to keep starting over.
So if someone, you mentioned that there's challenges, there's sort of barriers to sometimes seeking that help that you may need. If someone really wanted to reach out and just find out, how do I overcome this barrier I perceive in my head? Is there a way I can get to that treatment I need? How would they contact you to do that?
There's two ways that come to mind. I mean, one of them is you can pick up the telephone, and we have a local 358-4041 number, and you call that number and someone will answer the phone, a live person. I mean, you'll get a recording, you'll press option 1 for admissions, and you'll get someone to give you information on what the programs are, what's available. Or you can go to our website, which is phoenixhouse.org, and find out and read about the programs. You could then see a little bit what the Dublin facility looks like versus the Keene, versus we have a facility in Franklin. But those are the two easiest ways to access.
So if a person was worried, I don't have the money to get help, will you still help them?
Absolutely. I mean, there is some federal and state money that comes through the Bureau of Drug and Alcohol, which we call BDAS, not badass. And that money is distributed across the state to, I think there's 20 different providers of residential and intensive outpatient programming, and we're one of them. So Dublin has, I believe, 19 beds that are for the uninsured and the underinsured. Now, I am sad to say that there's a very long wait list for those beds because there's way more demand than there is capacity. And I'm also sad to say, but it is true, that many of the people on that wait list are incarcerated because they have done things that have resulted in them having to wait in jail, but they have a drug and alcohol problem that needs that level of treatment.
Is there anything that someone can do if they can't get in one of those beds? Are there still ways that they can begin to receive support and make change in their lives?
Well, as I had said before, we talked about AA and NA. I mean, we always encourage them to go to those meetings because they're surrounded by people who are not going to judge them, who are going to offer them help and assistance. And if they ask for things in those meetings, they'll find that they will receive it. Other than that, they really, there's not a lot of other support. We want people to be honest, tell their family members. There's outpatient services that cost far less than residential, and they could sort of start by seeing maybe a counselor and doing that on a limited basis until they could get into a treatment center.
Now, we do have some other resources here in the Monadnock region, and I know you collaborate with several of them. Can you talk about some of those collaborations, what some of those other services are? And also, could you mention where they would find listings of AA and NA meetings?
On the AANA website. I mean, they could also come into the Phoenix House, and we have them, as you walk into the front door, if you saw the picture of the facility, we have them right there on the wall. And we have the meetings not just here in the Keene area, but in the Peterborough area and all throughout the region. But they can also go online to find it. But when you speak of other, resources, I guess I'm curious what you're thinking of, because I mean, there's Voices of Prevention, and there's MADAC, which is an adolescent, but they don't really provide services that I know of.
Right, but we have things like MAPS. We're fortunate
absolutely.
to have here in the
Monadnock Family
region,
Services.
Monadnock Family Services.
Absolutely.
We have the Drug Court. We have Second Chance, and I know you're connected to many of those things.
Right. So in terms of when I was saying you could go to individual counseling to get some support while you might be trying to, if you can't do it on an outpatient basis, but then you certainly could reach out to Monadnock Family Services or MAPS. Both of them have counselors on staff that have specialization in substance use disorders. I mean, this might be a time I could just mention that many of our clients have co-occurring mental health issues. I think part of it is sort of the lens through which we look at people now. We see a lot more than we used to. And so, there is depression, there is anxiety, there's trauma, there's lots of things. But so there's treatment through those two agencies. And in terms of when I had spoken earlier about people that are often incarcerated, waiting to go to treatment, it's been an amazing addition to our sort of ability to help people is that we got a drug court grant that was awarded to Cheshire County, which opened last August. And so right now we have 11 drug court participants enrolled in it who are from Cheshire County, who are from the jail, and who, had to make a huge commitment on their part to say, for the next 2 years, I'm going to allow people that want to help me with my substance use problems, et cetera, and let them sort of control my life, but it will get me out of my sentence, and it will give me a second chance, which is also the housing, which is actually, I believe, owned by Southwestern Community Services. But the first 5 or 6 drug court participants were really quite fortunate because housing's always an issue, for people who are unemployed coming out of jail, and they were able to get into Second Chance, which is, I believe it's like 6 apartments with quads. They're very, very nice. I went to visit them, and we actually hold our drug court program there, which is like an intensive outpatient program right there at Second Chance. But it's like these really nice apartments. They have a case manager there, and they get to live there for free up to a year. Obviously, if they can pay, they are required to pay, but there's a lot of support, and they're given some vocational counseling and those kinds of things. So, you're absolutely right. All of those things are sort of a net to hold these people and try to give them back some of the opportunities that they've missed as a result of their addictive behaviors.
It's one of the things I so value here in the Monadnock region, that we're able to create these webs of support for people, and where the agencies really come together in creative and unique ways to try to best serve people. I would imagine that you probably have needs as a program for support. What are ways the public could be involved in supporting you?
Well, we have an annual event that we call the Climb for Recovery. And
I think we actually have some pictures of that we'll pull up while you're talking.
And so we've been doing it in June for the past 3 years, and weather issues, Keene State College graduations, high school graduations, it just seemed like it was not the best of times. So this year we are going to hold the event in September, and hoping then that we're sort of highlighting that September is National Recovery Month. And, I just love the image of Climb for Recovery at our, the beautiful mountain of Monadnock. It's a lot of hard work, but it's incredibly rewarding. So
I think the last picture we see there is people signing up to hike.
Exactly. So we are going to be, promoting this to the public. You can sponsor someone if you don't particularly want to climb yourself. It's a really great event. We have a lot of our clients from our programs throughout New England that even come up here to climb, and a lot of families and children, and it's a great event. So that's one way one can support. And of course, we'll always take donations if people want to make specific donations to the Phoenix House. And we take volunteers. We have a lot of interns from Antioch and Keene State that are a really rich addition to our staff. And I love it when I'm able to, like, for instance, right now, one of my counselors was a graduate last year from the Marriage and Family. She was an intern with us. She returned home to Georgia, and I'm happy to say I convinced her to come back, even though she didn't like the cold. And she's on staff, and that's one of the greatest difficulties I have in sustaining the quality of my program, is keeping the staff cared for and vibrant, and it's really hard to find licensed master's level counselors. So anybody that wants to go to school.
So there's a real need for young
absolute,
people, young adults, to really pursue that educationally.
Absolutely. And we have some very good programs. I mean, Keene State has an associate's degree in chemical dependency counseling where they could start there. And Antioch offers quite a few programs from a PsyD, which is a clinical psychology degree, to marriage and family, to dance movement, to licensed mental health counselors. And not everyone has to be licensed, and not everyone has to be at that level of education to help. I have a lot of different staff members who don't have college degrees or just have a bachelor's degree, or we work as a team. But we also have medical staff, so it's a whole array of people. But having volunteers that come in from the community and students is just it's great for the clients and it's great for us.
Now, so we've talked a little bit about volunteering. That's certainly an opportunity there. People being able to give, whether it's through an event you have going on or making a donation. Certainly when they donate to the United Way, we try to support the agencies out there as well. But one of the things we haven't touched upon, which I know Phoenix House is involved in across the state, is advocacy. And whether that's people in recovery coming and really being advocates related to the legislative issues or the legislative cuts that we're facing, advocacy at the local level. I've seen people in City Hall advocating. So can you tell us a little bit why Phoenix House embraces that, and why you think the people that have gone through the programs of Phoenix House embrace that?
Well, I think because they see what a difference it's made in their lives, and they also know probably firsthand some of the stigma they've experienced and some of the weights that they had to experience to get the help they got. So, that sort of firsthand experience certainly lends to it. I think, we've been very involved, like when you say on a local level, one of the coolest things about our city hall and was the ordinance we passed that was banning spice. I mean, people across the state have wanted to do that, but Keene was actually able to do it. Now that started from a parent whose child had done it and really suffered some very adverse consequences. But, the Phoenix House clients and staff were there at City Hall and trying to really advocate for the banning of that. There's an organization called New Futures, which is really, it's funded through the New Hampshire Charitable Foundation, but it's an advocacy and sort of dissemination of information to the public that has really helped Phoenix House, because they've reached out to us, they've sort of educated us on how to best advocate for ourselves, and they spread the word. So anyone can be a part of that. And I think, we know that the only way to sort of raise awareness and raise funding is to be changing the laws and what governs us. So the whole prescription monitoring law that was passed, that still I don't think has quite totally happened, but that was a huge thing to try to prevent those individuals who become addicted to their pain medications or to someone else's pain medication going, pharmacy to pharmacy and doctor to doctor. This is a way to track it and to hold them from doing that. The whole medication take back that, you were very instrumental in your prior position, which was awesome. I mean, we were so shocked by how many pills were brought to those take back events of people that just kept their pain medication. So, I think that's really, it's not just the isolation of the treatment, it's the whole continuum of recovery can start anywhere, anytime with anyone, and the more we can publicize that at all levels, the more successful we'll be.
Now, are you doing anything on the prevention end? Are you working with young people so that they don't reach that point of needing treatment? Or if you're not, who is in the Monadnock region?
Well, I was going to say, in some ways, we were very instrumental in that, because Jennifer Whitehead, who worked for Phoenix House for 7 years and ran she was part of the Monadnock Adolescent Treatment Initiative, which was an outpatient program funded through New Hampshire Charitable Foundation to really bring adolescent substance use treatment to this region. There was none before that grant. And so for 5 years, we built a program that to some extent is there, though not in the same way. But so Jen Whitehead got a lot of experience and then ran our intensive outpatient program and is now working at Keene High School that actually funded a full-time substance use counselor position where she can do a lot of prevention and intervention. And intervention is really the thing in between the prevention and the treatment. You know, it's sort of like maybe I'm harmfully involved, but I'm not to the point where I really need treatment, but I need to figure out what's going on. And the Phoenix House does have SASSY, which is Self-Assessment Saturdays for Youth, which is an intervention program, which we've run for years and unfortunately does not get many referrals at all. And we're trying to sort of put our heads together and figure out why kids aren't taking advantage of this, or families or schools. So, but that's a place where they can come and sort of assess their use and decide, maybe make some different kinds of choices. MADAC, you know, which is the Monadnock Adolescent Treatment
Alcohol and Drug Abuse Coalition.
Yeah, right. I'm involved with them, and they do a lot of great work that's on the prevention end of things. And you know, I guess the other thing I can say is that, you know, I sit on the Governor's Commission on alcohol and drug. I can't even say the whole word, but it's for the alcohol and other drug, and it's made up of all commissioners, and then there's a few people that represent prevention, treatment, and recovery. And I have sat on that commission for 9 years, and I co-chair the treatment task force. So out of that, we try and bring different events and legislative, ideas up, and it's a very small state when it comes to, like, you know who you can approach to get help, and it's a very committed group of individuals who work really hard. So Tim Rourke, who's the chair of that, and who also works at New Hampshire Charitable Foundation, has made huge strides as the chair of that Governor's Commission. I mean, you know, we have a plan for the state, a 5-year plan that is really laid out of what we can and should be doing. And there's outcomes, and we can measure the progress we're making, and we are making progress.
So share a little bit about that, because I think lots of times people think, oh, we're not going to change anything when it comes to substance abuse. And we have seen some significant changes. We have new challenges emerging,
yes,
as we deal with the opiate situation. But, and, you know, we have really made tremendous strides in people's lives. And, you know, even that piece of viewing it as a disease, and that it's a lifelong process, that's a huge shift in the way people think
Right.
about substance use.
Right, and not thinking that if someone relapses, they've failed and that treatment didn't work, because in fact that's not true. And you know, we at Phoenix House, we do follow-ups. So we when we discharge someone, we have their permission to get in touch with them at 1 month, 3 months, 6 months, 12 months. And you know, that's a lot of phone calls, if you can imagine. So I can't say that we do them all, but you know, just if I take like a picture of the last month and I look at all the calls that were made to clients, 60% of the clients that we called were still clean and sober and in recovery a month after they left treatment. So, you know, it's not always that good or that bad, but 60% is, you know, if you compare that again to diabetes and the rates that we have for other chronic diseases, that's good.
It's very good, and it's actually people being able to be in the workforce, people able to live their lives different than they were.
Right.
So, and I think we sometimes forget that. We look at it and we're saying, well, it's only 60%. Well, that's 60% of people now that are contributing members of society, and
Absolutely.
maybe had some challenges around that previous to it.
Yeah.
So very important. Again, I want you to let the public know how they can reach out to you, and particularly parents who may be concerned about their young adult or teenager, because you mentioned the self-assessment Saturday. So how would a parent, again, reach out to you, or a citizen in the community who needs help themselves?
Right. They would, again, I mean, call us at the Phoenix House at 358-4041. If they wanted to talk to me, they could press option 4, and I try to help them. But option 1 is our sort of central intake, where we've tried to make it easier for the public to reach us, so they don't have to call Dublin if they think that's what they want, or, you know, it's one number to get information for any of our programs, or even if they said, how do I get to an AA meeting today? I mean, we can show them where they can get the information they need. So for self-assessment Saturdays, the same thing. So once you press that option 1, we have 2, you know, full-time, very knowledgeable women who are answering the phone 24/7, giving out information. Or if it's a parent calling, which often for an adolescent it is the parent, you know, we give them all the information about the program. Sometimes that we connect them right to the facility to speak to one of the staff there. But then we say we're going to have to, they'll do the interview there on site for the adolescents. There's a very strong family program at the adolescent program that runs like every weekend, where families are invited there and so it's a very big piece of that treatment. At the Keene Center, we do a lot of family work as well, where we do sort of a family education session every Saturday. And because people didn't always go to that, they just wanted to visit their loved one. We're like, no, you got to pass through the front office and go to family ed, and then you go visit your loved one. So we set them up sort of right piggyback to each other. And it's really to help them understand what to expect from treatment, what their expectations are around early recovery. You know, sometimes we think, well, they're fixed, or what's wrong with them. You know, it's a lot of education and knowing where to turn for help. So you had mentioned, you know, Al-Anon, which is for families, and we very, very strongly recommend that family members who are living with the disease of addiction, because it is a family disease in that way, can get help there, and a lot of help. And there's a meeting right at St. James at 5:30 every Sunday for that group of people. And it's non-judging, and so, you know, there are those supports.
So that's the 358-4041?
Yep.
I
Option
remember
1.
that 4041 because they go right together.
Yeah, and it's option 1 will get you the central intake and the admissions. And, you know, that's where you can get that. So I don't think you can make it too much easier. Now, sometimes you have to leave a voice, you know, leave a voicemail, but you'll get a call back within that business day.
The other thing I want to remind the public about is that they can always call 211. And
Absolutely.
211 will direct you to organizations like Phoenix House when you're in need of service, whether that's for your child or for yourself. So 211 is an easy number to remember. It's universal across the United States, and we do have it here in New Hampshire. So I would encourage people to call that as well. Lee, any last thoughts or messages that you'd really like the community to be aware of?
Yeah, I think, you know, and hearing what you were just saying now about how do I get help for a loved one, is that really the way we like to start the process is by doing an assessment. So when someone calls and says, you know, I need help, we do a phone screen with them, which takes like 15 to 20 minutes. But, you know, getting that assessment about, you know, where are you at? What do you need? Knowing that there's no judgment in it, that it's confidential. It's not going to be reported to anyone. And that's why we have this whole thing about you need a release of information. Like, we can't talk to your brother who may call and say, you know, did Joe call for help? You know, I can't tell you that unless Joe gave me permission. And, you know, we obviously take those things very seriously to protect people so they feel safe in sharing what's really going on with them. So I just would encourage people to say, you know, I don't know what kind of help I need, but I know I have an issue and I need some advice, and we will do a face-to-face assessment if it's local. We'll start with it on the phone, and that's the message that I really want to get out there. And that doesn't, the phone assessment is free, and the face-to-face assessment is usually covered by insurance. I mean, always covered by insurance, and if not, it's $75 to have like an hour and a half with, you know, a trained person who's going to give you some good sound assessment advice.
And I really want to remind the public that don't let the fear of the cost of something turn you away, because
Right.
I heard you clearly say there's ways you'll help them find some of
Absolutely.
those resources that they may need. And that's really important, because I think lots of times people, maybe it's an excuse, but sometimes it's an actual reality for them where they think they can't seek help because they don't know how they're going to support that
Right,
help
and
they
they're
need.
usually financially not always in the best shape by the time they reach out for help. So the other message really is don't keep waiting. And, you know, unfortunately, the disease of addiction is a disease of denial. So the person usually suffering from it is the last person to know they have it. Like, everyone around them is like, what are you doing? You know, this is really bad, whether it's their employer, their spouse, or et cetera. So, you know, the sooner that we can get rid of all the stigma and those barriers and say, just, you know, a phone call is not going to cost you anything, and you might find out that there is help.
So a great message, and you're doing some fabulous work out there.
Thanks,
We're
Kelly.
so appreciative to have organizations like Phoenix House, and we are fortunate to have Phoenix House right here in Keene and serving the Monadnock region. I really want to thank you, Amelie, for joining
you.
me tonight and for being here. As I mentioned at the top of the show, you know, this has always been something I've cared deeply about
Yes.
here, both in the Monadnock region and for particularly our youth. So I really want to thank you for the work you do.
Well, thank you for having me.
And I want to remind the public, again, that you can call 211 if you're in need of these types of services, or call Phoenix House directly or visit their website. I also want to remind you that there's an opportunity here to give and to volunteer and to certainly be an advocate, whether that's an advocate for a family member that you may have, or an advocate when it comes to these types of issues at a local and a state level, and even a federal level. It's important that we support them. It's important that we're there because it affects all of our lives. I want to thank you for joining us and remind you to live united.